What a chance. Well, with the rising life expectancy, but without quality life years gained, despite ever increasing healthcare-related costs, the global community faces a challenge. CHRODIS Plus is a real European response to this challenge. The response is to assemble European expertise in order to combat the situation, which seems to be the new norm across the different European healthcare systems, in a way which COVID seems to be. CHRODIS Plus has an important role with valuable results, which will affect the health of the European community. As a scientific coordinator, I trust that activities triggered by CHRODIS Plus can bring the change that is required to tackle chronic diseases by successfully implementing best practices that are created and proved successful within Europe. It was one of the biggest joint action tackling the burden of non-communicable diseases with a concentration of focus on real and not theoretical implementation of good practices. A total of 42 beneficiaries representing 20 European countries worked hard to close the evidence practice gap. You have had a chance to take a brief look through the presented insights of their work. On the surface, the steps to closing the gap between research findings and existing clinical practices are simple. First, identifying good practice. Second, piloting. And third, scaling up. However, promising initiatives and the big players overseeing them often get stuck at the very first step. At the same time, mechanisms like crowdfunding and startups have proven to mark a shift from the few major players towards community-driven initiatives, often based on ideas and passion. CHRODIS Plus showcased how ideas and passion on a small scale can be transferred to cross-national learning while respecting national interests, and explored the successful factors to piloting, transferring, and also sustaining good practices that benefit patients affected by chronic diseases. CHRODIS Plus working groups showcased outcomes of the CHRODIS Plus joint action, focused on supporting member states in scaling up practices aimed at reducing the burden of non-communicable diseases. Hopefully, the discussions, how learnings on both the successes and barriers from the joint action can be taken forward, will also help health stakeholders achieve policy impact in the future. Further spread of effective innovation across different healthcare settings is driven by an obvious necessity, but to make sure all lessons learned are scaled up, and you're all invited to take one step further and picture a broader view. To reach this change and real actual gains required more than 7 years for our CHRODIS group. But CHRODIS Plus map how research-based innovative management on non-communicable diseases can be adopted in real-life practice is on acceleration. And the further impact is on actually the exponential growth. It is now only the question how hard you are prepared to push it for a result. And I'm looking at probably everyone attending here. Hope that during today, relevant speakers from different sectors covering science and academia, clinical practice, public sector, and civil society helped you to compose a broader view how to make sure that findings would be widely used in practice across the EU. Feel free to join the moving CHRODIS Plus train and use available knowledge that helps to close the evidence practice gap. The potential value and impact member states could reach by using CHRODIS Plus outcomes is really huge. CHRODIS Plus is coming to an end. So naturally, there comes the question, what is next? And obviously, what did it do? You can consider our joint action as a tool for piloting potential actions and preparing for national scale-ups. While using CHRODIS Plus outcomes, you will have a know-how of cost-effective, effective interventions to be applied in different contexts, methodology, but also, most importantly, motivated implementers who could be leading the processes with only small support from the ministry level. I'm happy today you had a chance to overview of what are the values which could be used by all member states as ready-made tool for good practice implementations. The hard work CHRODIS Plus different teams have all passed together, cemented us in one fist that has definitely made some noise in the European healthcare history. CHRODIS Plus good practices, implementation strategy, and early adopters, motivated implementers that used it to make a change, laid a good ground for further practice development within their countries. It is a great joy to see how the joint action, initiated and supported by the European Commission and the member states, transfers to actual measurable gains, methodology for repeating the results independently of the joint action, a network of experts and widely available database of good practices. All of it is like, I would say, Christmas for any motivated implementer. Could it be healthcare ministry? Could it be institution? Could it be just an eager physician where actual gains are directed towards actually EU citizens? If I had to put our joint action in 4 steps, this would be the top of my list. First, we have gathered professional scientific network by identifying good practices and relevant stakeholders, developing local implementing working groups, and attracting potential collaborators. The second, we have tested the theory in practice, and let me highlight that evidence-based practices is one of the biggest achievements. We have proved concept that a good practice can systematically and successfully be transferred to different environments with great results. Thirdly, we have analyzed and reported the outcomes in a metrological manner, sharing the know-how, giving it a chance for others to replicate it. And fourth, most importantly, the implementations are real. Applicability and gains for the EU citizens are real, and further gains will now count on further member state involvement rather than the joint action, which always has a beginning and an end. I'm really happy that it already empowered some of you to facilitate a political debate on a national level, to support the implementation and encourage the scale-up of the practices aimed at reducing the burden of non-communicable diseases. Hopefully, the rest will join and will increase European and multi-country collaboration using one of the final CHRODIS Plus deliverable, which is policy-level position paper or consensus statement. This paper will guide future work in Europe on non-communicable diseases with a focus on EU added value of cross-country collaboration in the field of non-communicable diseases. Well, to sum up today, as presented by CHRODIS Plus partners, the practices we have tested, the CHRODIS Plus methodology framework we have elaborated, and the outcomes we have delivered can bring benefits to each member state who choose to implement or scale up our outcomes nationally. All our results are owned by member states, so the stakeholders that seek for efficiency in their healthcare and innovative ways to tackle the burden of non-communicable diseases should potentially use them. I'm Rokas Novickas, scientific coordinator of this great group of CHRODIS Plus people. I hope the information shared today will spark some useful processes, and CHRODIS Plus outcomes will facilitate all of you in further steps within your country or institution when using any of the accumulated know-how from those years working as one of the largest joint action in Europe. Thank you.
Just the coordinated team would like to thank all those who have presented and all the speakers for the effort for carrying out this final conference forward and more dynamic in a challenging format that we have never seen before. We also like to thank the clinician for the implication and the work it has been doing during the last 3 years. And the achievement we have, the things that we have achieved, and the nice results we have been shown during this event today. We cannot finalize without thanks, in particular to Zoltan, his team, and the work package too for the great effort on the preparation of this final conference. Finally, I would like to invite all of those who have been participating to ensure that the results of this joint action are published and will be used in the member state, and that have achieved our goal. And finally, we will be able to improve the health of the population with chronic condition. I think we have doing very well during these 3 years, and I hope that the special situation that we are now will improve in the future, and we will have more favorable that will give us the opportunity to see again personally in the near future. Thank you, all of you, and thank you all the effort made to arrive to this final conference.
Okay, thanks, Moita, for the closing speech, the farewell speech. And I would just add a technical detail that we are still working on some of our results. And in the chat, I've put you a link. It's chrodis.eu/our-work, where you can access a page from where you can reach all the core work packages, the pages of our core work packages and the results. We'll be still upgrading some of these pages in the coming couple of weeks, including the videos that you have seen. Some of them or most of them will be published on these work package pages. So if you come back in 2 weeks' time, 3 weeks' time, it will be complete. It has to be complete by the end of November. So dear conference participants, dear friends, dear CHRODISian friends, it was also a pleasure for us from Szemvesz Medical University in Budapest to organize and host this meeting. I think we all learned a lot, and I think now I just would like to wish you a very nice, healthy evening. So we suggest you do some sports, you eat some healthy food, you meet some friends to keep your mental balance all right after watching a laptop for like 8 hours a day. So I think you should be switching off your mobile phone or your laptop and do some sports and enjoy some company and have a nice rest. So thanks for spending this day with us. It has been a fantastic day for all of us, and well, hope to see you somewhere again in some of the many European projects that are around. So this is not a final goodbye. This is just a temporary goodbye from our end. So have a nice evening, and thanks a lot for your participation at the CHRODIS Plus closing conference. Goodbye. Good night.